Okay, today we are going to go through a list of symptoms and you're going to tell me which ones apply to you. Okay? All right, let's get started. First, I just want you to, I'm going to list off some areas of your body and I just want you to tell me if any of them hurt. Okay? Okay. So, abdomen. Okay. And back. Chest. Ear or ears. Okay. Head. Pelvis. Okay. Tooth or teeth. Okay. Skin. Okay. Okay. And then any extremities, so legs. Okay. Feet. Arms. And hands. Okay. Are you experiencing any chronic pain in any of those areas? Okay. All right, and now I want you to tell me if you feel any of the following sensations or symptoms, okay? All right. So, do you feel chills? Fever? Paresthesia? Paresthesia would be numb feeling, numbness, tingling, maybe like a jolt type of sensation, jolting, electrical jolt, anything like that. Okay. All right. Lightheadedness. Okay. Dizziness. So dizziness, where you feel like you're about to black out or pass out. All right, and then dizziness, where you don't feel that way, but you do feel as if the room is spinning around you. Okay. Dry mouth. Great. Nauseation. Do you feel nauseated? Okay. Sick, like you have the flu or something like that. Okay, and then sick, like you might vomit. Okay. Do you feel shortness of breath? Okay. Sleepiness. Okay. Sweatiness. Thirstiness. Tiredness. And weakness. Okay, great. Okay, now I want you to tell me if you can't do any of these things, okay? All right, so you can't breathe normally. Can't hear normally. Okay, and then we've got 3 conditions there. So we've got can't hear normally, you feel like you're losing hearing. Okay. Can't hear normally, sounds are sounding like they're too loud, louder than normal. Okay. Okay. A ringing or hissing in your ears that's preventing you from hearing normally. Okay. All right. You can't move one side So that could be arm, leg, or both. Okay. You feel like you can't urinate normally? Okay. You feel like you can't remember normally? How you normally do, yeah. Okay. All right. Do you feel like you can't see properly, like you're blind or experience blindness? Okay. Can't see properly and your vision is blurred or blurry. Okay, and then a little bit different from that, I feel like you can't see properly and you have double vision, seeing double of images. Okay, great. Let's see. Do you feel like you can't sleep normally? Okay. Do you feel like you can't smell normally? Smelling is off. Okay. Speak normally. You can't speak normally. Speak how you normally would. Okay. Feel like you can't stop scratching. Okay. And feel like you can't stop sweating. Okay. Swallowing. You feel like you can't swallow normally, how you normally would. Okay. Taste. Like your taste is not normal. You're not tasting things as they would normally taste. Okay. Walk. Do you feel like you can't walk in the way you normally would? Okay. And writing, handwriting. Handwriting, do you feel like you are having trouble writing as you normally would? Okay. Okay. Would you say that you are experiencing any of the following to the best of your knowledge? Weight loss. You've been losing weight, noticing changes on the scale, noticing a drop on the scale, drop in weight. Okay. Okay, do you feel like you are experiencing cachexia? Okay. Any chills? Shivering? Okay. Okay. Any convulsions? Okay. Do you notice any deformities anywhere? No? Okay. And any discharges? Unusual discharge? No. Alright. Okay. Dizziness? Or vertigo? Okay. All right, fatigue. Am I experiencing malaise or asthenia? Okay, any hypothermia? Jaundice? Muscle weakness? Okay. Pyrexia? Sweats? Any swelling? Lymph nodes, you have swollen or painful lymph nodes? No. Okay, and then weight gain. Same thing with the scale. Have you noticed it going up? Weight going up? No. All right. Let's talk about some cardiovascular conditions. Have you experienced any arrhythmias? Bradycardia? Okay. Chest pain. Okay. Claudication. Palpitations. Okay. And tachycardia. Okay. Ear, nose, and throat. Do you have any dry mouth? Okay. Epistaxis. Halitosis. Any hearing loss? Kind of covered that before. Nasal discharge. Okay. Okay. Otalgia. Otorrhea. A sore throat. Toothache. Okay. Tinnitus. All right. And trismus. Okay. All right. Let's talk about GI, gastrointestinal. Are you experiencing any abdominal pain? Okay. Any bloating? Belching? Any bleeding? Okay. Constipation? Diarrhea? Dysphagia? Dyspepsia? Flatulence? Okay. Heartburn? Nausea? Okay. Okay. Audinophagia? Okay. Okay. Proctalgia, fugax? Pyroses? Okay. Okay. And steatorrhea? Okay. And then once again, any vomiting? Okay. Okay, let's touch on hair. Any alopecia? Hirsutism? Okay. Hypertrichosis? All right. Skin. Let's talk about skin. Any abrasions? Okay. Any anasarca? Okay. About petechia? Okay. Purpura? Ecchymosis or bruising? Okay. Any blisters? Edema? Okay. Itching? Any Janeway lesions? Osler's nodes? Okay. Lacerations? Rash? Urticaria? Okay, let's talk about some neurological symptoms. Any abnormal posturing? Okay, about alcaculia, agnosia, alexia, familiar one, amnesia. Okay, anomia. Okay, anosognosia. Okay, aphasia or apraxia. Okay, ataxia. Cataplexy. Any confusion? Okay, and dysarthria. Okay. Okay, and dysdiadochokinesia, dysgraphia, any hallucinations, headaches. Okay, hypokinetic movement disorders, akinesia, bradykinesia. Okay, hyperkinetic movement disorders like akathisia, athetosis, bulismus. Let's see, blepharospasm, chorea, dystonia, fasciculation, any muscle cramps, myoclonus, opsoclonus, any tics, any tremors, insomnia, any loss of consciousness. Okay, any neck stiffness, paralysis, paresis, paresthesia, prosopagnosia, somnolence, all right, let's talk about some ocular stuff. The eyes, amaurosis fugax. Okay, some of this might repeat, but that's okay. Just answer again. Blurred vision. All right, Dalrymple's sign. Double vision. Okay, exophthalmos. Midriasis. Midriasis. Okay, midriasis. Meiosis. Nystagmus. Great. Let's talk about some psychiatric elements. Amusia, anhedonia, anxiety, apathy, okay, confabulation, depression, delusion, euphoria, irritability, mania, paranoid ideation, any phobias. Okay. Right. Okay, let's look at pulmonary. So apnea, hypopnea, cough, dyspnea. Okay, bradypnea, tachypnea, orthopnea, dyspnea, and trypopnea. Okay. Okay, how about hemoptysis, pleuritic chest pain, sputum production. Okay. rheumatologic, any arthralgia, back pain, sciatica. All right, urologic. All right, urologic. Any dysuria, hematospermia, hematuria, impotence, polyuria, strangury, urethral discharge, urinary frequency, urinary incontinence, urinary retention. Okay. All right. Let's check one other thing here. I want to go through that list of phobias and just try to pinpoint anything that needs to be more specific. Okay. And so we'll just go through this here. All right. Do you have a fear of darkness? Fear of noise? A fear of heights? Fear of aircraft or flying? A fear of certain inescapable or unsafe situations? Okay. A fear of crossing streets? Okay. Fear of sharp or pointed objects, like a needle, a knife? Okay. Fear of cats? Fear of chickens? Fear of ducks? Fear of pain? Okay, about fear of strong scented food products like garlic, onions, chives, or shallots. Okay. Fear of wind or drafts. Fear of adult men. Okay. Fear of human beings. Okay. Excessive fear of fear of infinity, eternity, or the uncountable. Okay. Fear of being touched. Okay. Fear of bees. Okay. Fear of amputees or becoming an amputee. Fear of water. Fear of spiders or other arachnids. Okay. Fear of thunder and lightning or lightning. Okay. Fear of imperfection. Fear of failure or being evaluated negatively by other people. And a fear of isolation. Okay. A fear of bacteria. Okay. Fear of walking or standing erect, and or a fear of falling. Okay. A fear of frogs or other amphibians. Fear of needles or pens. Fear of books. Fear of ugliness. Fear of cancer. Fear of mirrors. Fear of chemicals. Fear of happiness. Fear of bats. Fear of colors. Fear of time or the progression of time. Fear of clocks. You have a fear of food. Just food in general. Fear of having no escape and being closed in. Fear of cemeteries. Fear of clowns. Fear of computers. Fear of computers. Okay. Fear of dogs. Fear of headaches. Fear of trees. Fear of dentists or dental procedures. Fear of deleting files or of losing your computer data. Fear of houses. Fear of driving. Okay. Fear of real or imaginary body defects. Yeah, fear of being involved in an accident. Okay. Fear of cataclysmic environmental change. Fear of mirrors or seeing your reflection in a mirror. Okay. Fear of vomiting. Okay. Fear of crowds. Fear of insects, broadly speaking. Do you have a fear of youth? Fear of horses? All right. Do you have a fear of work or functioning? Fear of sexual love? Fear of the color red? Or fear of blushing? Fear of becoming too cold? Fear of sharks? Fear of marriage? Fear of being laughed at? Fear of bridges? Fear of sexual intercourse? Fear of knees or the act of kneeling? Do you have a fear of growing old or aging? Do you have a fear of the elderly? Fear of balloons? Fear of speaking in public? Fear of nudity? Fear of nudity? Fear of adult women? Fear of bad breath? Fear of being touched? Fear of the number 17? Fear of obtaining pleasure? Fear of the sun or sunlight? Fear of worms? Fear of blood? Fear of reptiles? Fear of the number 666? Fear of travel? Fear of sleep? Fear of illness? Fear of illness? Fear of fish? Fish? Okay. Do you have a fear of buttons on clothing? Fear of tornadoes or hurricanes? Fear of butterflies or moths? Fear of cooking? Fear of people in masks, costumes, or mascot type Outfits. Do you have a fear of large objects? Do you have a fear of the color black? Fear of bees. Killer bees. Fear of being alone or isolated. Fear of mice or rats. Fear of mushrooms. Fear of ants. Fear of germs. Fear of death or the dead. Fear of newness, novelty, change, or progress. Fear of the night. Fear of being out of mobile phone contact, out of a service area. Fear of hospitals. Fear of contracting a disease. Fear of returning home. Fear of numbers. Fear of darkness. Fear of gaining weight. Fear of home surroundings or household appliances. You have a fear of eyes. A fear of dreams. Fear of snakes. Fear of being stared at. Fear of birds. Fear of odors. Just a generalized fear, fear of unknown origins, unknown cause, just kind of a general sweeping fear. Okay. Fear of babies or children. A fear of swallowing. Fear of medication. Fear of spooky ghosts or phantoms. Okay. Fear of love. Fear of leaves, like tree leaves. Fear of fear itself. Or a fear of phobias. Fear of loud sounds or loud voices. Okay. Fear of beards. Okay. Fear of the color purple. Fear of flying. Fear of fire. Fear of radioactivity. Okay. Fear of trains or railroads. Let's see, a fear of social situations. A fear of standing or walking. A fear of partially or fully submerged man-made objects. Do you have a fear of graves? Do you have a fear of being placed in a grave while you're alive? Okay. Fear of advanced technology. Fear of making or taking phone calls. Fear of the number 4. Fear of the sea or the ocean. Do you have fear of high temperatures? Okay, fear of childbirth or becoming pregnant. Fear of invasive medical procedures. Fear of being poisoned. Do you have a fear of hair loss? Okay, how about fear of the number 13? Do you have a fear of injections or being stuck with a needle? Okay. Do you have a fear of holes or textures or the pattern of holes? Okay. Do you have a fear of driving? A fear of roller coasters? You have a fear of the workplace? Fear of the color yellow? Okay, do you have a fear of people lacking resources? Do you have a fear of youth? Okay, fear of mental illness? Okay. I believe that is going to take care of that list. So we will look that over and get back to you shortly, okay? All right, thank you.